October is Breast Cancer Awareness Month, and there are several ways that breast cancer can impact your skin. There can be a direct extension of breast cancer to your skin to the point that I've actually diagnosed several breast cancers based on their manifestations in the skin as their preliminary findings. Breast cancer can actually spread to the skin. I've actually had patients where we've diagnosed a skin lesion, a biopsy from a skin lesion, only to find out that it was breast cancer that had metastasized to the skin. There can be side effects from treatments from breast cancer. Chemotherapy, radiation can have their own impact on the skin. And of course, there can be other changes to our skin, hair, and nails as a result of treatments as well as stress from the diagnosis itself. A study in Brazil reviewed the dermatological complaints during the course of breast cancer treatment and found an astounding 94% of patients undergoing treatment for breast cancer had dermatologic complaints. At the very top of the list was hair loss. This has probably changed in recent years with the nature of medications that have come out. However, at the time of this study, hair loss did top that list for a variety of reasons. Sometimes it can be a result of the medications that are used to treat the condition, as well as underlying stress that we experience during the course of management of the diagnosis. Followed by hair loss were nail changes and then thickening of the palms and soles. Other complaints in the study that patients made note of were redness, ulcerations, blisters, dryness, itching, and changes in their sweating. This study was also fascinating in that it found that 22% of patients had skin changes at the time of diagnosis of their breast cancer. The types of skin changes that they noted were mammary retraction, nipple inversion, a peau d'orange-like look to their skin, which is when the skin starts to look thickened with the pores seeming widened or patulous like the skin of an orange, and even direct extension of the cancer onto their skin at the time of diagnosis. Because of these skin changes and because early diagnosis is so important to survival and for best outcomes, it's always important to go through what people have experienced before so we can learn from this. That way we can really understand together better how to get people diagnosed earlier and look for signs, clues, and symptoms before it progresses.